Hi, I'm Dr. Lisa Thompson. I'm an associate professor at the Nell Hodgson Woodruff School of Nursing at Emory University in Atlanta, Georgia. When I was a nurse, I worked with pediatric patients and asthma. I went into their homes and saw the indoor air pollutants they were exposed to, the outdoor air pollutants they were exposed to. Then I applied to a PhD program at Berkeley, and I'm asked to start working on a project that was funded to work in Guatemala on cook stoves. I didn't know that the problems of cooking over primitive fires was something that affects 40% of the world. Globally, 40% of the world cooks over these types of stoves that mostly in African countries and Asian countries, India. So I just dove into this research, and then I have been working in Guatemala since 2001. I'm part of a trial now called the HAPPEN trial. Over the past 5 years, we recruited 3,200 pregnant women in Guatemala, Peru, India, and Rwanda. It was a randomized control trial where we recruited women who used these solid fuel cook stoves and randomized them to receive a liquefied petroleum gas stove, kind of like when you barbecue with the gas and you have the little tank. These are the types of stoves that we gave women, gas stoves with tanks that they could refill. And we followed them during their pregnancy and then their infants to 1 year of age. And we were looking to see if the indoor air pollution could be clean, comparing the women that use solid fuels with the women that use gas fuels. The trial will be ending in 2 weeks. So our last child will turn 1, and so we're analyzing the results now. But we do know that the prenatal exposures were reduced significantly if the women were using these gas stoves. Now, some might ask, I'm doing climate change research and we're giving liquid petroleum gas, which, is a bad actor in the climate change space, to pregnant women in these countries. And that's because many women lack stable electricity in the rural areas, and so electric stoves are not an option for them. And these types of gas stoves are in the transition from wood stoves to electric or solar stoves that work well. So this was a trial to see if we could reduce household air pollution considerably, and the only viable option at that time were these gas stoves. I am so thrilled to be one of the nurses that was inducted into the International Hall of Fame. I've been a member ever since I was a student in nursing in the 90s. And I have had students funded through Sigma to do global health research, specifically in Ethiopia. So I think my role as an educator is to train the next generation to address these issues in their research and their teaching.